is real. Seek help. End the stigma. On the news this evening, former Governor Amechi charges younger generation on how to wrestle power from politicians. Obiakpor residents criticize appointment of 230 aides by council chairman. Stakeholders react to U.S. president order halting distribution of HIV drugs to poor countries. On the foreign scene, U.S. mourns after no survivors from Washington, D.C. plane and helicopter crash. I'm Sam Chinedu, and the news continues after the break.
Of 100 persons, 200 persons. Cottage industries that will employ same use production is not worth it. There are so many things that can be done. So many things. But this question of AIDS is unproductive.
It's just that he want to settle his supporters. Others, another way, just for him to settle his political supporters. Nothing like impact. Because our office is not allocated to them. No impact to the economy. It will not create any impact to the society.
Also by they mounted some solar installation of lights, and also at Cornerstone here, also they're doing also at Puru Junction leading to T Junction, they already walk the road, and at Tunoko they mounted transformer too.
Recall that the chairman of Obiakpor local government area recently appointed 230 aides, while the council chairman of Omuma, Promise Reginald, appointed 220 aides. In another development, some business owners in Port Harcourt are calling on members of the local security outfit, OSPAC, to conduct themselves properly. The appeal follows the unveiling of a rebranded OSPAC by the chairman of Obiakpor local government, Chijoke Hunwa. Speaking with our correspondents, the business owners expressed concerns over the way security levies are collected, describing it as forceful and intimidating. They called on the new OSPAC members to put an end to such practices and instead focus on supporting the police in tackling security challenges. in the area.
They should not compromise. Not we have security still. Armed robbers will be robbing. Like this our line now. They do rob. You close your shop in the night, they will enter and pack whatever thing that is inside. So they should secure well.
There are security levies. They come monthly. When they come, they will tell you, OSPAC levy is due. If you don't have it, you see them behaving violent, they want to take your things, you come and bail it with extra money. They should be more mature in their approach.
They dey better now. Before they dey too rude, may they not go back to their old behavior.
We expect conducive environment, like securing life and properties of the citizens they are protecting, which is the major aim of them being security.
As you may know, OSPAC was disbanded last December by the Obiakpor Council Chairman following a series of complaints against members of the security outfit and their involvement in criminal acts like torture, arrest, and detention of people. In other news, River State Flood Prevention and Management Committee has commenced the distribution of agro-based products like special cassava stem, fertilizers, and farm implements to farmers affected during the last flooding in parts of Orashi region. Wheelbarrows and shovels, as well as other medical consumables, were also distributed yesterday to the affected flood victims in the 4 local government areas that make up the Orashi region. The Deputy Governor and head of the Flood Prevention and Management Committee, Ngozi Odu, said the distribution of these items is a third out of 3-pronged approach to tackling the flood menace.
Phase 3 has components within them. One component is agro-based. We also now have something on medical. They have been packed in 4 groups for the 4 LGAs that we are supporting today. Basically, these are the things that people need once there is a flood issue and people get back.
The Deputy Governor said the sum of 24 million naira has been provided to support 200 households across 4 local government areas whose houses were impacted by the flood.
That will give some little support to people, like people that have mud houses or houses that were impacted during the flood. For the 4 LGAs, we've made a provision of 24 million naira. So the LGA generated the list for us. So we're going to make transfers to each and every one from the local governments that have been so nominated. So your money won't go through any other person.
She said the post-flood intervention is aimed at giving a new lease of life to victims. The 4 local government areas that make up the Orashi region are Oba, Egbemandoni, Abu Odwal, Ahoda West, and Ahoda East. Head of Orobuji community in Mpolu, Orowarukwo, Port Harcourt City local government area of River State, Elder Sonny Tom Obuji, has warned land grabbers against further encroachment into their landed properties around Sandfield area. Elder Tom Obuji, in an interview with journalists, said the land grabbers are working with some persons to go against court orders which restrain both parties from using the land pending determination of the court. Elder Tom Obuji, while commending security agencies for their swift response today, encouraged them to continue the supervisory process to avoid breach of law.
The land belongs to Orobuji community. So one of our brothers sold it out by force. That is notice of famine. So now we went to court. No matter because the matter is in the court. Court people put a court injunction that nobody should do anything there. We are surprised how the man went back there and started doing some.
On his part, Council Collins Bekwele, who is also a member of the community, said some persons who acquired properties around the disputed lands have also started encroaching with the help of a family member. He warned that the Orobuji community will take all legal actions to ensure that its properties are not tampered with. He called on land purchasers to always do their due diligence to avoid purchasing or renting disputed properties.
Issue is this, it is out of greed. So when you have some people in the family who do not do anything, they are idle. He has virtually sold everything he had, inclusive of what the benefits he got from my late father's assets. He has been selling them. An example is one behind the Oroworuko police station. You go there now, you see a 2-story building put up by a small boy he sold the land to. He sold the land to an Igbo man. A little boy that built 2-story building close to his house. Now, that's not enough. He has involved himself in family properties. And you go to sell without the consent of the family head and the principal members. That's not a valid sale. We strongly believe that with the presence of their lawyer and the instruction dished out to the workers on site, they are going to stop. And if they refuse, we want to let the police know about it.
Moving on, the Court of Appeal, Abuja, affirmed the proscription of the Indigenous People of Biafra, IPOB, as a terrorist organization. The court, in a unanimous decision by a 3-member panel led by Justice Hamma Barka, affirmed the judgment of the Federal High Court in Abuja, which outlawed IPOB. The court ruled that the federal government acted lawfully by proscribing the organization whose activities threatened the nation's security and continued existence. The convener of Revolution Now movement, Omoyele Sowore, has been granted bail to the tune of 10 million naira and one shorty in like sum. Justice Musa Suleiman Liman of the Federal High Court in Abuja ordered that the shorty deposit the original documents of landed property and a passport photograph to the registrar of the court. Justice Liman also ordered Sowore to deposit his international passport with the registrar of the court. Still to come, stakeholders react to U.S. President's order halting distribution of HIV drugs. Stay tuned. Welcome back. A medical expert, Stephen Okoro, has expressed concern that the people of Rivers State are being shortchanged due to non-operational status of the Dr. Peter Odele Cancer Cardiovascular Diagnostics and Treatment Center, as well as the Mother and Child Hospital inaugurated by the past administration. Dr. Okoro, in an interview with our correspondent, said that while the concept behind both centers is commendable, their lack of implementation undermines their intended benefits. He said it's a waste of resources if such centers are not put to good use.
These projects are supposed to better the healthcare of the people. If we had these centers functioning, it would have reduced this demand for health tourism going outside. I think that's what led to doing these projects in the first place. And it will be a very big plus for the Rivers State government to get those centers working. The people will be happier for it. There are supposed to be centers of excellence on health services, and the health of the people will improve, and the government will have a big plus.
In March 2024, the Rivers State Commissioner for Health, Adeze Ore, gave reasons why both hospitals are not operational. Dr. Ore said the operators in charge of both hospitals pulled out of the partnership. However, 2 weeks ago, the State Commissioner for Health said the two hospitals are not open because they are not operational. She said efforts are underway to ensure it is open to the public.
For the Mother and Child Hospital and the Cancer and Cardiovascular Hospital, efforts are underway to ensure that that facility is open to the public and not open in terms of being a tourist attraction, but being able to deliver quality services for the use of the people. The facilities are not open because they are not currently operational. That is why they are not open. Until they are operational and able to attend to patients and deliver quality health care, they will not be open.
Some persons living with HIV in Nigeria have raised concerns over access to antiretroviral drugs after the U.S. President Donald Trump ordered a 90-day freeze on foreign aid. The cuts by the Trump administration will affect the supply of antiretroviral drugs during the president's emergency plan for AIDS relief, PEPFAR, which Nigeria hugely benefits from. Speaking with correspondent Martha Okere, the Rivers State coordinator of Network of People Living with HIV, Chigozie Blessing, described the mood of those affected by the U.S. temporary freeze on aid. She said much of the field work, training, and meetings will slow down.
It has been very horrible. For the past 2 days, I've been answering a lot of calls. I've not rested. Many are crying and say they're hearing that there'll be no more drugs, there'll be no more funding. How are they going to cope and all that? And you know that this is what we're doing. We are saving humanity. So it has not been easy. A lot of cry, a lot of sorrows, a lot of where do we do, what do we do, where do we go, how do we cope? So it has been raising a lot of dust. Many are feeling at this moment that the world has just ended.
In Lagos State, the coordinator of Network of People Living with HIV, Patrick Akpan, said the aid freeze has started interrupting HIV services in Lagos and other states in the country. He, however, said the Lagos State government is working out modalities and will intervene pending when the suspension of the U.S. aid freeze is lifted. Mr. Patrick, who is living with HIV, said the suspension of aid is an eye-opener for the federal government to begin funding HIV services and activities.
If people stop taking drugs, what it means is that the virus will increase, and that will mean that we are going to have more new infection, and a lot of people will die. So I hope the government of Nigeria will take this suspension as an eye-opener so that they can start taking responsibility, because we cannot expect the international community to continue to fund our HIV activities all through. There will be a time that they will stop, and if they stop, it is the responsibility of Nigeria to take care of its citizens.
Meanwhile, the National Agency for the Control of AIDS, NACA, says the federal government will intensify domestic resource mobilization strategies towards ownership and sustainability of the HIV response in the country, with a view to reducing the risks of donor aid policy shifts to the HIV response. NACA's Director General, Temitope Ilori, in a statement said the government will ensure that the country's strategic goals and targets in the fight against HIV are achieved. The statement said through effective stakeholder collaboration, creating favorable policies and enabling environment and advocacy to policymakers, Nigeria can still achieve the target of ending AIDS by 2030. It encouraged the patient community to continue accessing HIV treatment services in service delivery points across the country and appealed to all state governors, private sector partners, all the members of the National Assembly and state houses of assembly, civil society organizations, the media, and all other relevant stakeholders to continue in their commitment and support to the fight against HIV/AIDS in Nigeria. The news continues after the break. Welcome back. On the international scene, no one is believed to have survived after a plane and helicopter crashed in mid-air over Washington, D.C.'s Potomac River. 64 people were on the American Airlines flight and 3 on the military helicopter when the aircraft collided near Ronald Reagan National Airport. Emergency Services Chief John Donnelly says 28 bodies have been found so far. On the news this evening, you heard former Governor Rotimi Amechi has charged the younger generation on how to wrestle power from politicians. Obiakpor residents are criticizing the appointment of 230 aides by council chairman. Stakeholders have reacted to U.S. President's order halting the distribution of HIV drugs to poor countries. And on the foreign scene, President Trump said the U.S. is mourning after no survivors from Washington, D.C. plane and helicopter crash. The news was edited by Onyeka Chinwosu. To reach the news team, send an SMS or WhatsApp to 0808-721-7215. I'm Sam Chinedu. Thanks for listening.